A lot of women are getting their fertility MOTs.
I don't even know what's involved.
Hi, I'm Dr. Jen.
I'm Dr. Remy.
And together we are co-founders of Niara Health, a women's health online platform.
The aim of Niara Health is to empower women and educate them about their own reproductive health, their gynae health, and empower you to take charge of your outcome. So today's video, we're going to be talking about a fertility MOT. What even is that?
So many women are getting these fertility MOTs, and as young as in their 20s.
Yeah.
And there's so many different around. When I did a random Google search of it, like, you've got these Groupon offers, you've got so many clinics offering it. Like, it's literally a minefield.
Yeah. I guess I would actually want to know what they're actually testing. Because when we see women in the fertility clinic, we know what we're testing them for, right? But what are they getting on these, like, tests?
Some of them offer an ultrasound scan and others offer a blood test. Some offer a combination of the two.
Okay. So I guess in this video we can talk specifically about the blood test and if it's worth doing and what information it would actually give you. So we mentioned the ultrasound scan, but the blood test actually is done, like you said, Groupon, but so many companies are offering what you would call an AMH test, and that's an anti-Müllerian hormone test. And the point is to tell us how many eggs you have left at that specific point in time.
Yeah.
So going back to the 20-year-old, knowing what your egg reserve is, so to speak, when you're 20, isn't going to be useful information when you're 35.
Absolutely.
If you don't repeat the test.
Going back a little bit, so we're talking about egg reserve, but basically what we're talking about is the number of eggs we have left. So as women, we're all born with a fixed number of eggs, and that's usually about 1 to 2 million eggs. And as we go through puberty, when we start having our periods, that number declines over time, and it's a natural aging process. And we expect that number to go down. We know it's higher when you're younger, and as you get older, it declines.
Yeah, I will never forget being in med school and then putting that graph on the board of what your fertility is expected to be like. And we were in our late teens, early 20s, and you could just see that graph drop. Maybe we'll put it in the video.
Yeah.
And now we're in our mid-30s.
And when you get to the part of your life where you're at the steep decline, it's like, oh.
Yeah. And so that's why when I'm around women who are in our age group, who are like, I'm getting my fertility MOT, I'm like, yeah, you go and find out.
And I guess, why do we want to find out?
Okay.
It's your choice.
Yeah.
So if you want to find out, it's your choice. If you don't want to find out, that's also your choice. You don't have to.
Yeah.
But it gives you some more information about where you're at this stage in your life.
Yeah.
But like Remy was saying, the result you get today isn't going to be accurate for you in 10 years' time.
Yeah, 100%. And I think it's also really important that looking at the level of the AMH, or when we were talking about the scan, which can actually count the follicles, the number you get is only specific to your age group.
Yeah.
So it might seem like a high number, but actually 10 years younger, that would have been a low number.
Yeah.
And also you don't know how quickly your eggs are declining, because it's, again, just a snapshot. So yeah, I think it's really important to not get fixated on the number per se, but just use the information. Is it normal? Then yeah, potentially if you were to try and conceive now, barring that everything else was okay, you should get pregnant. Whereas if it was really low or borderline low, you might say, whoa, I'm 3 years, 4 years off having a baby.
Exactly.
Do I need to think about other things to maximize having a baby at a later date, like egg freezing?
Yeah, because I have so many women who come in, they want to know, but they're so scared about getting the result just in case it's low.
Yeah.
It is a scary result to get to think about. You might not be ready to have a baby. You might not be ready to start a family. You know, that might be years in the future for you. And now you've got this result and you don't know what to do with it. So it gives you the information that you need to make a decision about where you are in terms of deciding if you want to start your family earlier, or if you want to even freeze your eggs.
Yeah, true. And obviously it's a bit of a financial privilege to be able to get the test, because I hear lots of women who are paying for it out of pocket because their GPs won't do it. And again, it's contentious if your GP should do it or not, if your GP will do it or not. So it is a bit of a information that I think is nice to have.
Yeah.
And then you decide, can I wait? If I can't, can I freeze my eggs? So there are times where the number can be so low that they would say you're not necessarily suitable for freezing your eggs, or your chances of sort of natural conception are really low. And I think if you got that result, that would be really hard to take.
Absolutely.
When you're going for a fertility MOT, you actually have to be prepared that the answer to those tests could be very difficult for you to have a baby, either naturally or with fertility treatment.
But that doesn't completely exclude it.
No, it doesn't, no.
So you can still conceive, but it might be a lot more difficult.
Yeah. And I would say as well, like, there are cases that are recorded where women would have really low AMHs and then they would go on to conceive naturally. But those cases are rare.
Have you thought about having your AMH tested? Is it something that you would do? Let us know in the comments below.
Yeah. And I would say we've got on our Instagram page a couple of posts about egg freezing, right? Because I think it's really important that if you're going to do this, you might want to consider your options. I would say check that out, but also comment down below if you want us to film something specifically on egg freezing, and we would be happy to do so.
Thank you so much for watching today's video. We hope you found it informative. Please remember to like, comment and subscribe, and watch out for our next video coming soon.